Hello, I'm Norbert Gleich, MD. I'm the Medical Director and Chief Scientist here at the Center for Human Reproduction in New York City. Today I want to talk to you about LGBTQ and how we can you help, whether you're a woman or a man, whether you're two women or whether you're two men. You are patients like any heterosexual couple is. There are very little differences. In principle, the processes are very, very simple and very, very similar. Whether you're a same-sex couple or you are a couple that usually can conceive on their own at home and doesn't need our help unless they have a medical problem. That is obviously not the case in most same-sex couples. The reason why they don't have babies together is because they're either missing eggs or sperm. And so the first thing we do as a fertility center in those cases that we make available the missing gamete. That in practical terms means that if we have a same-sex male couple, we obviously need eggs, and more importantly maybe, we also need a uterus. In other words, we need a gestational carrier. On the other hand, if the same-sex couple are two women, there are maybe even too many options, because suddenly we have two women who theoretically can get pregnant. We have two uteri, but we don't have the sperm that is required. And that is obviously much, much easier to get than a gestational carrier and eggs. So I would say that female same-sex couples have a much easier and usually shorter and quicker route before them than two men who really have to find donor eggs and have to find a gestational carrier. When two women want to form a family, one other option comes into play, and that is that both women can have a baby. And therefore, not infrequently, one of the choices they make, not always, but as one option, one woman provides the uterus and carries the pregnancy, while the other one provides the eggs for the baby. Usually it is the sperm donor who stays the same if that couple has more than one child. So, two women have obviously a little more options. But in principle, it's the same as in spontaneous pregnancy, making a family, creating a family. And that's what we are here for. We take care of same-sex couples every single day. And not to forget, we also taking care of single parents, whether it is a single woman or it is a single man. If it's a single woman, again, we obviously need to just help in securing donor sperm. If it's a single man, once again, we have to find an egg donor for them or with them, and a uterus, meaning a gestational carrier. In principle, there are no restrictions today. Everybody who wants a family can have a family, and we are honored to help you in doing that. Thanks for listening.